talking about multiple factors, I would think also that there might be multiple factors too, that there are these disparities. How would you explain them? I mean, this is a country where doesn't everybody have access? It might not be equal access.
That's a great question, and that's the focus of a lot of debate, because it used to be thought that it was as simple as, well, African Americans didn't have access to health care because they didn't have insurance or didn't have the finances to pay for it. And what we found is that it's much more complicated than that, because even when you look at African Americans that have good jobs, that have good insurance, that have the resources, there's still a number of ways we look at things, both from a societal perspective, a religious perspective, a social perspective, and how do you employ those resources? You know, for example, one of the things that we always kind of joke about is in the African American community, the church is really a central focal point for information dissemination. Okay, and when you look at most of the country, when we talk about utilizing healthcare resources, one of the places we always talk about people getting information from is the church. Like, if the pastors really get behind an idea, it's much more likely to take root and be effective and grow than if it's just something that's advertised on television or put in the paper. So even individuals that have healthcare resources, that doesn't mean they utilize those healthcare resources. One of the big issues we have as men is men are healthy, right? We don't go to the doctor. In fact, the only time we go to the doctor is when there's a problem. And that's when we're kicking and screaming, and usually it's the wife or the girlfriend or a significant other that actually makes the appointment and makes you go to the physician, because men just don't like to go to the doctor.
Now, that's men in general, right?
That's men in general, absolutely. But when we look at African American men, when you look at the outcomes research, one of the things we talk about, it becomes clear that African Americans still, even when they have similar financial resources, don't utilize those resources to the same extent as their counterparts.
Now, not all of those African Americans with the resources are church-going.
That's true.
That
so
is true.
How then do you explain, presumably, they have more resources, they're probably better educated. So how do you assume, I mean, how would you explain this?
Why they don't use the resources?
Yes. One would assume they have the access, they have more access.
It just, it comes down to many times what you value as important. And I can tell you that a lot of times we look at prostate cancer, there are a lot of stigma that go into prostate cancer screening. For example, let's face it, prostate screening involves a blood test and what we call a digital rectal examination. Many men just aren't comfortable, especially in the African American community, with a digital rectal examination. Now, there are a lot of reasons for that, and unfortunately, the consequences of not, many times undergoing just routine screenings are pretty significant. But let's face it, where some people are at is that, there are a lot of feelings about, hey, nobody's going to do that type of examination to me.
Well, I would think most people would not be comfortable with that type of examination, right?
Absolutely.
But you're saying more so for certain ethnic groups?
Maybe more of a macho factor, I think, among African Americans.
I would think maybe among Latinos, perhaps.
I would say both.
And the data would suggest that.
I think both have this masculinity thing that is more intense than it is among whites. Also, I think that African Americans may not trust the white-oriented health system. And unfortunately, we had things in our past like the Tuskegee experiment and some other things. There have been stories about how African Americans do not get the high-level medications for ailments. There are stories about how there's a delay in getting treatment, let's say if you went to the emergency room among African Americans. So there's a lot of distrust with the system. There's also this anxiety about not wanting to know the outcome.
Mm-hmm. Mm-hmm.
All of this really comes down to education, maybe a lack of education in the community, but there's this notion about, I don't want to go to the doctor and get a chest x-ray because they may tell me that I have cancer. Or if I go to the doctor, they'll probably find something wrong with me because they just want to make money. So I'll just avoid all of that by not getting the test. That way I won't have to face the reality that maybe there's something wrong with me.
Yeah, and surely I think there's also, again, following on with that, since the the doomsday that I'm going to die of something anyway, so I'd rather just go ahead and live my life and not know what that is. And that's quite unfortunate. Some folks do have that idea that, well, you got to die of something. I'm not going to stop smoking. I get a little bit of joy out of that, and so the doctor's going to tell me to stop doing everything I like to do.
Well, how do you deal with that logic? Certainly, we do have to die of something, right? Even if it's natural causes. What makes up natural causes? So how do you deal with the person who says, I want to enjoy my life? And if this harms me, it harms me, but at least I'm getting some enjoyment out of life, however short it might be.
Clearly, suffering is a motivator for many folks. When they know that there's suffering involved, and tremendous suffering involved with some of these illnesses that can be prevented, or certainly that can be helped through medication or through medical care, there's a motivation to kind of avoid that suffering.